The point here to make in the slide is a means to achieving patient safety. It's something very, very important. A lot of people think that communications, what is there to learn in it? Let's, after reaching to some more slides, you will be able to realize what's the importance of this. Well, I don't have any conflict of interest. Let's see what are the general objectives. To define the verbal and non-verbal communications and their impact on communication. What we had learned in last time was the non-verbal communication. If you recall, the empathy in healthcare was in relation to non-verbal communications. And what we have today is to learn about the verbal communication and what are the barriers to that communication. What are the specific objectives? Is to explain why the assertiveness is important characteristics of a professional communication. You will learn much more about what are the different modes of communications, and specific to our healthcare is something known as SBAR framework for communicating with a provider. I mean, it is for the intercommunications. There lies the importance of SBAR. We will see what next. Reflect on the impact of effective communication in overall patient safety. Time and again I will be highlighting what is effective communication. A lot of times we do have many jugglery of words where it doesn't have any great advantage to the patient. So there is the importance of saying effective communication. Now, here we are seeing three forms of communications. One is aggressive. Aggressive communication, what the examples are commonly used by the critical parents when we are shouting, scolding to our children. Second is assertive, that's more of an adult kind. And the passive aggressive is when the child is communicating, because they have their own demands and they find their means of communication only to get their needs and demands fulfilled. So, from this slide, it is very, very obvious that we should not have any aggressive communication. At the same time, we should not have any passive communication. So, an assertive communication, what we need to mention is to start with that I feel, I need, I mean what you feel, you are mentioning that. What you need, what I need means what investigations, what you think that is right, that is what we need to get it done. And what I want, at times patient might negotiate with you, no, not this, not that. So you will have to be firm on something that this is what is wanted by you to reach to better conclusions. And lastly, there comes the importance of what I think. At times, people turn out to be so authoritative that people may not like it as well. So, at the same time, it has to be more open, honest, direct, and equal to. Now let's understand much more about the assertiveness. And the assertive communication is the ability to express needs and feelings freely in a way that is self-satisfying as well as socially effective. Focus on reasonable compromises rather than on winning. Many times we do get into conflict and we try to win the things. Better to get away from any kind of arguments with anybody is to agree with them and let them be happy with that. So, ability to negotiate reasonable changes and solutions, ability to plan, sell and implement the agreeable solutions. So, this is assertive communication. An aggressive style may be appropriate in competitive situations when dealing with immature personalities, life or property at risk. So, the communications is the exchange of information between a sender and a receiver. Healthcare communications is any type of human communication whose content is concerned with health. Quite obvious. Effective communication skills are vital for patient safety. We have highlighted already. Now let's see some statistics. What is the importance of communication? How they have come up to this? And communications, effective communications is one of the IPSG, that is International Patient Safety Goal. So here lies the importance where the JCI has come up with their studies in 2004, where the communications has been found to be one of the most commonest problem in the root cause information for the delay in treatment events. Another JCI statistics reflects that the communication is resulting. In 2004 they came up with the statistics that communication stands on number 3 in the root cause information of fall related events. Now the fall related events, fall prevention is also one of the IPSG goals. Number 6 IPSG goal is fall related events. So if you see the fire related events, again communication comes on the top. So these statistics reflects the importance of how much learning communications is important in healthcare. This one is again related to another IPSG goal, that is the root cause information for wrong patient, wrong site, wrong procedure events. As per the JCI statistics, it reflects very clearly, the communication error stands on 3rd number. So these reflects that what are the importance of learning proper communications and why it is needed to be more skillful to that. Now consider the following situation. The patient in emergency department needs a chest X-ray to rule out a pneumothorax. Remember the situation where the patient is in emergency and the physician has requested the nurse on call to arrange a chest X-ray. Assumes, and she is assuming, doctor has assumed that the sister knows that patient is in emergency. But these are all at times what we call it working at spinal level. They just send the patient to the X-ray department. Now here it was very, very important that the doctor must instruct the patient, not only patient, but must instruct the staff also that the X-ray machine has to come to the emergency department and patient is not going to, because the suspected diagnosis is pneumothorax, right? So, let's see, what do we know about communication? A recent hands-off study supports literature on the psychology of miscommunication. The speakers systematically overestimate how well their message is understood by the listeners. Speakers also assume that the listeners has all the same knowledge that they do have. So, by now we have very well understood that there is something wrong with our system. And what is that? The assumptions that somebody, the one whom we are talking to, maybe our staff, maybe the patient, he has the same knowledge. So, where the system is failing, we need to rectify there. And quality, what do we talk about the quality healthcare? Quality healthcare, every time you will hear from me, if I am presenting, I always talk about 2 things. When we talk about quality healthcare quality is delivering the right care first time, every time, and right thing, right time, and every time. So, communication is very important, and this is where we need to look for. So, let's see now, what are the symptoms of poor communications? If the poor communications are happening in terms of patients, what will happen is the return rate will be low, their survey scores will be poor, complaints will be increasing, they will be more non-compliant, they will have more fear and anxiety. In terms of staff, we will have high turnovers, high resignations incidents will increase, there will be substandard performance, there will be low morale, absenteeism and tiredness. So for the organization, it becomes very tedious because there will be inconsistent processes. Leader turnovers will be high, increasing litigations and increased expenses. All the healthcare institutions have one common problem, that the leaders get bucked up in 2 to 3 years' time. So in healthcare industry, every 2-3 years, there will be a big demand for CEOs. So let's see now what is happening in lack of communication amongst the department staff can lead to failure to sharing information with the team, requesting information from others, directing information to a specific team members, including patient and their family in the communication involving their care. Now let's see what are the communication challenges. The first barrier which comes over is the language barriers. The place where we are working in a place like Qatar, where we have more than 21 countries, patients reporting to us quite often, we come across this kind of problem. People even from India, where we have more than 25 registered languages. So it is very major problem in communication barrier, particularly in surgical situations where the patient needs to understand each and everything. And you have to document that the patient has been explained in the language what he understands. He has to accept in writing that I have understood in my own language. There are, of course, we can make use of other means of technology as well to make use of some softwares. Those who have been working with me, they know it. I have been making use of certain things. Recently, I had one patient who understands only Hindi, and we were giving all those pamphlets and the informations in English. So he said, no, I can't understand this. So I immediately clicked a picture of it, translated it to Hindi, and gave him printout. It just took us around 3 minutes. So we need to be updated with the technology part as well. Now let's see what are the, next to the language barrier and other challenges, coming with the distractions. We need to get into so much a habit of right kind of communication that these kind of distractions should not affect. We need to get into the right kind of format. What is happening with this? The physical proximity also, there will be a lot of people where we need to target the specific communication to the right person. So we need to understand the language what the other person will understand. Here comes another importance of the major challenge, that the same personality, same person may be in a different moods. First, he might be coming with a very aggressive looks. Next time, he might be a little bit in a more comfortable and a smiling mode. And again, you find the same person a little bit in more disturbed appearance. The next challenge is the excessive workload. Those who have worked in ICUs and all, they find really very much perturbed. By the end of the evening, they are really, end of their working hours, they really feel so upset. They are totally disoriented because of excessive work. They get extremely tired and feel very much irritated at somebody is trying to ask some question which he doesn't feel like replying. So workload is another major communication. So that has to be taken care of. Overloaded situation. Then varying communication styles. We all have been coming from different backgrounds. Somebody coming from, even in India also, any other country, wherever you will go, people will be coming from different backgrounds. So the same thing people might interpret in different manner. So here lies the situation of conflict. One person on the other side may say 6, the other person will say 9, and the third person is observing both of them, they will say both of them are in a conflicted situation. And one has to make them understand that you both are right on your own side, but this is the real situation. So here lies the importance of the administration, those who are proper, well-trained communicators, those who have worked in administration, those even clinicians. A lot of clinicians, those who work in administration, they really develop those skills. So there lies the importance of proper learning communications. Now, verification of information also is very important. Many times certain things which are not very well verified, we may land up in trouble. I have mentioned one small incident last time. Again, I am highlighting the importance of it, that one patient having a similar name had received an injection. That is where lies the importance of this particular point, verification of information. Shift changes, again the same scenario. This incident when had happened, it was a shift change over time, and the information was X patient has been given test dose, he has to be given full dose. Next patient, next staff who are joined, they announced X name, and different person with the similar name entered and he received injection, whereas he had not seen even doctor. So such situations has to be taken care of. Verification of information and all these kind of things have to be taken care of. So how can we properly communicate? And let's see some of the things to consider. When need to consider the audience, whether we are communicating with our junior or senior staff, whether we are communicating with nursing staff, we should know very well patients and their relatives. We should understand their intelligence and their knowledge. We should know about it. Then various mode of communications, whether it is verbal, written, email, all these things, many times we have a lot of verbal orders, and every verbal order, any telephonic order also has to be documented. None of the telephonic orders should go just on verbal, passing from one person to another person. Specifically when you're working in hospitals, it becomes very, very important. Whatever telephonic orders, whatever verbal orders you have received, many times doctor might be passing on and he might give you some order which you have to document in his file, in that respective patient's his or her file. Unless you do that, there might not be any proof, and all documentations has to be like a running commentary of that patient events. Whether it be OPD or IPD, all documentations must reflect like a running commentary. The moment the patient entered in emergency or in OPD to discharge, everything should be very well documented, every event should be documented. Further advancement to what we discussed last time, body languages. At times when we get a little bit tired in the second half of the day and the evening part, this is how each and every picture in itself will give you, when somebody is sitting like that, it gives you the person a non-verbal communication that one is depressed, one is not comfortable, but we have to give a very fresh look all the time. One may take their own time in the restrooms, get freshen up, come back. It is our battle to look always fresh, because unless you are appearance-wise, your body language is in the right frame, people may not feel like communicating to you. So that's very, very important that your non-verbal communication should also be very appropriate. Now let's see how the things are being communicated at times. These are all resulting problems in various miscommunications. So this is how the abbreviations might be used, might be misinterpreted by different staff. Even doctors may also be using different abbreviations. So use of abbreviations has been practically restricted by JCI. The Joint Commission International doesn't recommend, doesn't allow anybody to use irrelevant, because everyone may have their own practices, everyone may have their own different abbreviations, and might become difficult for every staff and later on for evaluators, the medical audit people also might not be able to audit well, may not understand what exactly it is, and everyone cannot have their abbreviations list, so they are no more allowing it to do. So the simple rule is, whenever in doubt, check it out, offer informations and ask a question that I haven't understood, can you revise it again and let me know again. So let's see what are the contributing factors to ineffective hands of communication. Firstly, so far we have no defined process. Secondly, we have lack of staff commitment. Something which we take it granted, it is very difficult to gain commitment on that part. So we need to have repeated trainings. As we learned last time that empathy is also a skillful act which one can learn, that also the lack of commitment has to be addressed too. Same way the interactions. Interactions we saw it just now, there can be distractions, then inadequate preparations and inadequate staff education. This is what we are trying to look after now for staff education. This is very important. And lastly, very important part where the George Bernard Shaw said, the greatest problem with communication is the illusion that it has been accomplished. So, the members of healthcare team's duty is to be respectful of others' experience level, to communicate changes in a patient's plan of care with all pertinent care team members, listening before making a decision, developing standardized hands-off procedures for continuity of care. Well, this is last time I said one very important thing when I was defining what is apathy. Apathy is something which we cannot have, and this is a good expression of apathy. I am only responsible for what I say, not for what you understand. So in our profession, it doesn't work out. Whatever you have understood about that situation, you have to ensure that the patient or your staff or your colleague or all those related in the particular situation have understood in the same perspective. Now let's see what is assertive communication. I have highlighted a little bit early, but we are defining things a little bit more to highlight much more what we mean by saying assertive communication is essential to fulfilling your professional role and keeping patients safe. Assertive communication requires that you identify your needs in a situation and interact respectfully with others to satisfy your legitimate needs. Now, legitimate needs can be very different in different situations where we need to understand, like in operative situations, patient might not be explained for the complications. So each and everything has to be, we are in process of just doing and taking the fate of the patient granted. Now we are in an era where we have to practically consider that nobody is going to trust you. It is only your communication skills which is going to prevent you from getting into difficult situations. So, when to be assertive? On the unit, you may be identifying to obtain orders in an urgent situations, complete patient care by delegating to others, because you have very limited timing, and at times you might feel that your timing is getting over. So it is very important that you need to involve your colleagues and get things rightly in right direction. Then clarify an order that seems to be inappropriate. At times you may get some paper already pre-written and he will assume that you know these things, but before you are accepting anything, make sure that you have understood very well what is happening. Here also, all those staff who are there, I ask all my staff also that understand what is happening, what I am writing. If you have not understood, ask me 10 times, doesn't matter. But we should know what is going on. So report an error to your manager or to any provider. Gain support from a supervisor to address staffing situations. Confront a co-worker about the unethical behavior. Something if you come across, you must make sure that what is happening, everybody must have full involvement. What we discussed earlier, that comes in part of the staff commitment. Confront another team member about bullying behavior. I do have a habit, if some patient, somebody, any XYZ, if it doesn't behave well, make a note of it so that next time you are very cautious that this person has a different attitude. So next time you are more cautious, you handle things more strongly in a certain manner. So, assert thyself as a patient advocate. Advocating for patient means many times we feel that this problem is not in my domain. Why I should be bothered? But there lies the importance of understanding that if we think that we should be patient advocate, we are all, if you have a knowledge about a particular field and we know the importance of exercises, we know the importance of not smoking, we must be able to emphasize him. When everybody will talk the same thing, they will understand that yes, this is something not correct what we are doing. So, your most important role is that the patient advocate has to be understood well, and at times it takes an extra measure of an assertiveness to explore issues with a patient, questions an order or convince a provider to the urgency of your concerns. So, here comes the most important thing, that assertiveness is an attitude that of defending your rights without hurting those of others. So remember, learning to be assertive take time, practice and internal motivation. Once successful, however, the assertive individual is rewarded by being skilled in a variety of communication strategies for expressing thoughts and feelings, having a positive attitude about communicating directly and honestly, feeling comfortable and in control of anxiety, tenseness and shyness or fear, feeling confident that they can conduct themselves in a self-respecting way while still respecting others. So, what are the formal strategies for allied professionals? One such strategy was found in a communication model used by the Navy and nuclear submarine divisions, and that is called SBAR. We'll see what this SBAR stands for. Offers a simple way at standardizing communication, creates a common language promoted by JCI and WHO. Now, let's see some examples. What this SBAR model is. SBAR allows all the parties to have common expectations, what is going to be communicated, how the communication is structured, and what are the required elements. Focus on the problems and not the people. To have uniform use of the situation, S stands for situation, B stands for background, A stands for assessment, and R stands for the recommendations. We will see the applications of this further. So to improve the communication, build a better relationship and build teamwork between the healthcare workers. To decrease systems barriers, so more hands-off are completed with courtesy and mutual respect. To improve patient safety as evidenced by a decrease in incident reports and directly related to the hands-off miscommunications. So, as I said earlier, S stands for situation, that is what is happening with the patient. B stands for what is the clinical background. Then comes the assessment, what do I think of the problem, and the recommendation, what would I recommend. So, Here lies the big importance of a junior staff or a nursing staff communicating on phone to the doctor concerned. Might be a junior doctor, might be a senior doctor, might be a senior most consultant or head of department. So this is how you need to narrate the situation. Identify the person to whom you are speaking. Identify yourself, occupation and where you are calling from. Identify the patient by name and reason for admission. Identify what is going on with the patient, that is chest pain or nausea. Such situations I have come across a lot when we are working with 50 patients. If you are in charge, it is very difficult about which patient the staff is communicating, very difficult to understand. So these are the situations where we need to understand these descriptions has to be there. Then what is the background of the patient? What information what you are trying to give? The background information also has to come. Give the patient's presenting complaint. Give the patient's relevant past medical history and a brief summary of that background. Then comes assessment and the recommendation. The examples of what comes in assessment is what are the vital signs like, what are the heart rate, respiratory rate, blood pressure, temperature, oxygen saturation, pain scale, the level of consciousness. List, if any, vital signs that are outside of parameters and what is your clinical impression. Severity of patient and additional concerns. So all these things have to be communicated in this format. What are your recommendations? Because you are seeing that patient, you are facing that battle. So you should be able to communicate what are your recommendations, explanation of what you require, how urgent and when the actions needs to be taken. Make suggestions on what actions to be taken and clarify what action you expect to be taken. Like there might be situations where you might think that there is some post-operative abscess got developed. Third day, fourth day, 2-3 days, all the team might be taking rounds and the staff who observed it, they observed that the surgical area has become red and started oozing. Unless you give all this background information properly, and you might add up that I think that the patient has to be taken to operation theatre and redrain and check your wound. I don't think that patient is in the right status. So unless you will communicate everything properly, it won't raise any alarming situations. So this is how it has to be taken care of. Now, when to use this as bar? Urgent or non-urgent communications, nurse to doctor's communications, doctors to doctor consultations, conversations with peers, change of shift reports. Same format if we are following, it won't be a problem at all. And when we practice the same thing every time, it becomes a regular habit. Let's see some examples. A respiratory therapist calling the physician, telling that the S is the name of the patient, having shortness of breath, the name of the patient. Then he is a third day post-op, colon resection was done and who has been on room air. Then the assessment is concerned because he has labored breathing, decreased breath sounds on the right side, and the respiratory rate of 36, oxygen saturation is 85 on room air. What is his recommendation? He is supplemental oxygen now and should be get a chest X-ray, because unless the physician has agreed to it, and ordered verbally or on telephonic order, they can't get it done. So it is very important that we need to do. Let's see the second example. Complaints of pain in her right leg every time her sequential compression device. This is the situation where whenever the compression device is inflating, the complaint increases. The background is she is 3 days post-op, right hip replacement done and has not ambulated due to other medical complications, which can always happen. We do operate so that the patient can be ambulated early. But an elderly population will always have some kind of comorbidities which will not be feasible that patient can be ambulated. So, her right calf is red with mild swelling. Here lies your importance of assessment, because unless your assessment is right, nobody can make out what they should order and what they should confirm the order. then what the recommendations can be? Should we put her on her bed rest until you can evaluate her? So it just needs a confirmation about, okay, you can go ahead. Now let's see the third clinical scenario. The respiratory therapist calling physician that the patient is having increasing dyspnea and is complaining of chest pain. The background she is giving is she had a total knee replacement 2 days ago. About 2 hours ago, she began complaining of chest pain and her pulse is 120. Her blood pressure is 124 by 128 by 54 and she is restless and short of breath. Here, it's very important now to give your assessment and your recommendations. She may be having a cardiac event or a pulmonary embolism because it's a life-saving situation now. I started her on oxygen and should I order cardiac enzymes on ABG? So, unless the standard format of this SBAR is understood and practiced well, so the communication works for those who work at, this is, I started first in John Powell. Some preparation is needed to communicate with SBAR, gather relevant informations, formulate with thought is in a convenient manner and practice with the colleague, read back to them. This is some good example to make the things a little lighter. I'm going on quite a heavier side. What happens when you order a beverage? Burger at your local fast food restaurant, the coffee shop employee writes your order on a cup, then calls the drink order to the barista who is making. That's a tall, non-fat, extra hot latte. Very short communication, but it's a standard practice of his communication. And what all you have ordered, he took a big description from you. And in a short note, he has communicated to his staff what is needed. So that's what we also need to practice. So this technique is called the read back and it's nearly identical to the repeat back except you write down the information rather than relying on your memory. So importantly, the joint communication requires read backs for all telephonic orders and reporting all the clinical lab values. So we asked, do we have any policy? Yes, we have a proper policy of communication and all details are available on our website. I recommend all of you to strongly go through this policy. One should be completely updated. We are also in process of JCI inspections, so it's all a beginning of it. We all should make ourselves aware of all this process. So these are some more examples. We need to make clarifying questions as well. The second error prevention tool is when we reconfirm the things. Research has shown that when a couple of clarifying questions are asked during verbal communication, there will be a fewer miscommunication because of the wrong assumptions can happen. One question is usually not enough and more than 3 is quite annoying. So one has to be wise enough to practice right things. Clarifying the questions spoke for understanding and can be asked by a sender or the receiver. Use clarifying questions whenever a sender omits a required detail. An ambiguous statement is made and there is a high risk. So, what are the tips to reduce miscommunication? Pay attention to non-verbal cues and tone of your voice. Be assertive and get to the point. Use evidence-based tools like SBAR and read back in communicating with healthcare professionals. Patient safety is a shared responsibility. Effective communication is a cornerstone to patient safety. Thank you very much. That's where we end up. Thanks a lot.